Good afternoon, and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm Ashley Meservy.
Medical Monday, sponsored by East Cooper Medical Center.
Joining us today, we have Dr. Stephen Paletti. He's a spine surgeon here at East Cooper Medical Center. Thanks for being with us today.
Thank you.
All right, so we're going to talk about all the technology that you have access to, and that specifically we're going to talk about the Globus robot.
Right.
What is that?
Well, a robot is, at least as it relates to surgically, a robot helps guide incisions and guide placement of implants. And so in the spine, we often have to put screws or replacement discs into the body, and having the robot can help guide your incision to make it more precise. And so what's really changed in spine medicine is the imaging. You can now get a test called an MRI scan and get a crystal clear picture of all of the nerves and all of the discs in your back. We can use that technology from scanning, put that into a computer, and then hook it up to a X-ray machine that helps you guide the implants. And so we're able to do operations through small incisions, whereas even 10 years ago we would have to do it through a larger incision. So as a surgeon, how does that make you feel? Are you more confident going in there, or do you like it? But I find that sometimes people, is it kind of like being a pilot, that the technology, it kind of helps you be a better pilot? Oh, sure. I think it helps you be a better surgeon. Having this technology is better than not having it, right? And to a certain extent, surgery is like air travel. Surgery is like air travel. Air travel was safe 20 years ago, it's safer now. Surgery was safe 20 years ago, it's safer now. And these technologies that allow us to make smaller incisions make the surgery not only less invasive for the patient, but safer for the patient.
So when using this, is there like a specific person or candidate for this type of, like when would you use this, or do you use it all the time, or do you have to go back and forth between a traditional?
Right, well again, most of the surgery that we do now is done using these advanced technologies, using a microscope, using the computer, using the robot. The robot is specifically used when we're implanting something in the spine. So if we're replacing a disc, or we're putting some sort of fixation screws or rods into the spine, for example, in a teenager with scoliosis, we might put screws and rods into the spine and use the robot to guide those screws.
Does it help with recovery time too?
Yes, the smaller surgeries, if you will, the less the incision, the easier the recovery. The smaller the incision, the easier the recovery. And so people are getting up and around doing these surgeries often with just an overnight hospitalization instead of being in the hospital for days or weeks like we saw in the 90s.
Yes, because no one wants to stay in the hospital for days or weeks.
That's right, especially this day and age.
Exactly.
Nobody wants to stay in the hospital.
No offense, right? All righty, well thank you so much again for joining us.
Thank you.
And for more information, of course, you can always head online to eastcoopermedctr.com.